a CT heart scan for coronary calcium score. Not that CT coronary angiography with high radiation. Just a simple CT heart scan that generates a value, a coronary calcium score. That's about 10 chest x-rays worth of radiation. So it's not zero, but it's not terrible either. And it's very inexpensive. You can get it typically for about $100. Most hospitals have it. They're offering it now because they think of it as a lost leader. They want you to have a really high score so they can trick you into getting more testing. That CT coronary angiogram, heart catheterization, a stent, even if you don't need it. How often is that done? All the time. It's done all the time. So be very careful if you talk to any of the doctors or the staff when you get your coronary. They may try to twist your arm into more testing. Don't fall for it. They're trying to use the calcium score as a lost leader. They don't make much money on it, so they try to get you to buy more things. You know, if they talk you into heart catheterization and a stent, now you got a bill of $50,000 to $100,000. They make a ton of money doing this, so be very, very careful. But you can use that calcium score. So a normal score is 0. And then the scores go up to the thousands. And it tells you how much plaque you have in your arteries. People say things like, well, I don't care about hard plaque, calcium. I want to know how much soft plaque. No. Calcium is an index of total plaque. Okay, soft and hard and fibrous elements. So you can use that score. So let's say your score is 400. What if, and you're a, let's say, 55-year-old guy or maybe a 63-year-old woman, score 400. What if you do nothing? Not wise, right? What if you do nothing? How high will the score go? 25% per year. So a year from now, 500, another year, 625. So at a score of 400, you're about 7-8 years away from dying, or having a heart attack, or needing a procedure, really needing a procedure. Well, what if you took a baby aspirin, 40 milligrams of Lipitor, cut the fat and saturated fat in your diet, and exercised, a serious exercise program? How fast will that score increase? 25% per year. It has zero impact on that score. It's ridiculous, but that is the standard. That is the prevailing standard of care. My colleagues, even to this day, call that ridiculous mix of things optimal medical therapy. No joke. They actually call it that, which is absurd, right? So we're going to follow a diet that generates elimination of VLDL and small LDL. No wheat, grains, or sugars. And of course, you eat whole foods, right? You eat foods like beef, pork, fish, avocados, green leafy vegetables. You know the drill. Healthy whole foods, not fast foods, not junk foods, not preservative-containing foods, not ultra-processed foods, real food. But no wheat, grains, or sugars. That triggers formation of small LDL and VLDL. We're going to combine those 4 nutrients, iodine, omega-3 fatty acids, magnesium, and vitamin D, that synergize to minimize insulin resistance and inflammation. We're going to address the microbiome. We've seen it over and over and over again. People reduce their coronary calcium scores. Not 100%, but close.